The radiography program at Santa Barbara City College is probably the most intense program you will ever be a part of. We've had several students in the past that had master's degrees and have stated that the program is 10 times more difficult than their master's degree and or bachelor's program. Our program is 24 months in length. It combines both didactic, meaning in classroom or virtual learning, and clinical components where you're actually in a hospital setting practicing what you're learning on real life patients. So just be prepared. The two most important skills that you'll need is time management and discipline. There are 6 semesters, including the summer and winter intersessions, and the expectation is that you will be working, whether it be clinical or didactic, 5 days a week. This slide represents a reference of the first year curriculum. And so in the summer, you do take a positioning class that kind of helps provide you information for the following classes that come. In the fall semester, you have 4 different classes you're taking. You have a patient care class, you have a clinical education class, you have the positioning class, and then the introduction to a radiography technique class. In the winter intersession, you're focused strictly on the clinical environment. In the spring, you have a physics class, you have positioning part 2, and you also have a clinical class, and then you also have a class that goes into advanced techniques in the program. In the second year, you're focused on mainly clinical in the summer semester. Then in the fall, you do have additional courses that you take while you're in the hospital environment. And the same thing for your last semester in the spring. There's advanced courses that you take along with your clinical training. In your laboratory classes, you actually are using VR, and we are also retrofitting our x-ray rooms, so you'll be able to expose phantoms. But you're going to be using VR training to practice actually simulating x-ray exposure on mock patients. Keep in consideration that for your clinical internships, you do have 4 clinical rotations, so they could be different sites. You have to have over 1,700 hours of clinical hours that you perform in, and there may be a possibility that you drive 100 miles one way, maybe required for 1 rotation. The hours vary. As first year students, you have 17 hours a week, and then second year students, you have 24 hours a week. So it's a very, very intense subject matter. So here's a reference to your potential schedule for the fall semester. You're going to have online classes, and then Tuesdays and Thursdays you have clinical internships. So the lab courses themselves are actually going to be on Friday all day. Typically the students are split into groups, and then they come in small groups and do the VR training in person on Fridays. These are all the different clinical affiliates we partnered with, and this gives you a representation of where you may have to travel to conduct all of the requirements for your clinical internship training. This is a visual representation of all the different shifts and clinical hours you may be responsible for completing. So keep in mind that you may be doing a portable run at 5 a.m. and you may be doing a later shift starting at 12 o'clock. So you're going to be very busy while you're enrolled in this program. So I highly recommend to set aside some time to plan and prepare yourself for this.